Well, this morning, we're shining a light on a drug that continues to drive overdose deaths across the country. And because fentanyl can be hidden in counterfeit pills, experts say an overdose can happen without someone even knowing they took it.
And joining us this morning is Dr. Angelo Asheh with the Hanley Center to explain the warning signs and show us how Narcan can help save life. Dr. Asheh, thank you so much for being here.
Thanks for having me.
So let's start here. You know, fentanyl is responsible for a lot of overdose deaths. What makes this pill so incredibly dangerous?
So fentanyl is a synthetic opioid. It's very strong, and there's a small room for error. There's no room for error, really, with it because of the strength of the opioid.
Yeah, I mean, that's kind of like why when we hear these big busts, they talk about saving hundreds of thousands of lives with this big bust, even if it's, you know, some pills. Why can so little bit of it be so dangerous?
Well, you know, it's an opioid like Oxycontin or heroin or the other ones that we know of, but it's such a strong dose of it, and it's so potent that even a small amount can be very deadly to patients or people. So,
is there a way for people to know if they got a pill it's not from a pharmacy if it contains fentanyl in it?
Not really. So I always tell patients, unless the prescription is written to you and you're picking it up from a pharmacy, we really don't know. We don't know if it's what it is. So always go in with that assumption. But unfortunately, the illicit fentanyl that we see looks very similar to the real prescription ones that you would get from like a mainstream pharmacy. So it's dangerous.
Yeah. And of course, we've reported about other drugs being laced with fentanyl. People don't think they're getting fentanyl, and unfortunately, that's what winds up happening, and they wind up overdosing.
Unfortunately, yes. Sadly, we see it mixed with all different drugs, even things like THC and marijuana sometimes. So.
Let's talk about the other side of things here. You know, if you see someone, how would you know if someone was overdosing on fentanyl? What are the warning signs?
So warning signs are the person may look sedated, like they're sleeping almost. Breathing is a good thing to look at. So if their breathing's irregular, if you see that they're struggling to breathe, sometimes if you don't see them breathing, so looking at the diaphragm. Also, you might hear snoring or gurgling sounds. You can look at the skin. Sometimes it's cold and clammy. Also, you can look for signs of cyanosis or blue or discoloration of the fingers or the lips. So all those signs are signs and symptoms that will point towards an opioid overdose.
So if you're with someone and that's happening, what should you do?
So, you know, the first thing you want to do is call 911, or if somebody's around, have them call 911. Then you want to assess the patient, and Narcan or naloxone is something that's saving lives to many patients that come in contact with fentanyl or opioids. It's a tool that we use that can easily save a life and is easy to use for anybody.
And you brought some Narcan here today.
Correct.
Can you tell us how it works?
Yes. So Narcan is a opioid. It's an opioid blocker, essentially, but it can reverse an opioid overdose. So with Narcan, it's a nasal plunger right there. So you would just grab it, and with the Narcan, you use your thumb at the plunger, your two fingers at the top. You can put the patient's face back a little bit, and then you could just spray it into their nostril. The thing with Narcan is it only has one dose in it, but one's typically enough. What I tell patients is administer Narcan as quick as you can, but always, you know, try to still be in contact with 911. Usually it will work, but if not, sometimes a patient may need a second dose.
We just have a few seconds left here. Real quick, is it dangerous to give someone Narcan if they're not overdosing, and where can people get it?
So I would say it's more important to give it. It's relatively safe, but the potential of saving a life by using it, I think, outweighs any potential risks with not giving it. So, and it's over the counter now, so you can get it, you know, pharmaceutically, but also you can find it at any pharmacy or any local supermarket, Publix, for example. You can find it anywhere, and it's over the counter, so you can purchase it. Also, you know, there's a lot of prevention programs in the area, in the county, that hand them out sometimes too.
Great.
Dr. Angelo, thank you so much for being here this morning.
All right. We've got more Florida coming up after this.
For the best look.